talk about CT angiography in the assessment of lower extremity vascular disease. So these are my contents, and the interesting part is AI in CT. We will be discussing on upcoming slides. And what is CT angiography? Introduction. Lower extremity vascular disease is a medical condition which is affecting the arteries, veins, and the lymphatics of the legs, which are mainly occurs in the elderly patients, diabetic patients, and it will be more clearly seen in pain, swelling, ulceration, etc. And what is CT angiography? CT angiography is a minimally invasive procedure which is the evaluate the lymphatics and the arteries will be clearly seen in the imaging modality. The role of CT angiography is the important role plays in the evaluation of peripheral artery disease and some sort of conditions like occlusion, blockages, stenosis, and some sort of diseases. And we seen in CT angiography arteries clearly in the reconstruction modalities like multiplanar reconstruction and 3D volume rendering. And the anatomy we will be seeing here. The anatomy started with the abdominal aorta followed by renal artery, and then it will be bifurcates, and then you can see the common iliac and external and internal iliac arteries, and then followed by external and internal iliac, followed by popliteal arteries, and then followed by tibial arteries, anterior and posterior tibial arteries, and then tibioperoneal and peroneal arteries which we are seen in angiographic study. And the indications most commonly evaluating is peripheral artery disease, acute and chronic critical limb ischemia, and arterial thrombosis and arterial embolism. You can see the images were right here, and the contraindications we are most common is allergic to contrast media and renal impairment and pregnancy. And patient preparation, it is very quite simple. First we introduce ourselves to the patient as we are a technician or a technologist, and then we will check the patient name and UHID which we are evaluating with the patient is he is the patient or not. And then patient should be overnight fasting 4 to 6 hours prior to the exam, prior to the study, and we will obtain a serum creatinine levels for the contrast allergic risks, and we will take a patient history, and we will obtain a proper informed consent whether he is okay with the injection. And patient should be removed all the radio-opaque objects from the region of interest, and the patient should be changed to hospital gown, and then we will prepare to the IV access and contrast injection. And the equipments we are using is CT equipment and the dual-headed contrast injection and the non-ionic iodinated contrast media which we are using, Omnipac Ioxol. The dose of iodine will be 350 mg per ml. The proper patient positioning will be seen as supine, feet first, legs extended, feet should be together, and the hands raised above the head, and or else we will be positioning hands besides of the patient according to the scanner configurations, and the centering will be midline of the pelvis for the scout acquisition. And scanning protocol we will first of all we will acquire topogram image in the appian lateral position, and then the scan protocol will be contrast enhanced computed tomography. And the contrast injection, before contrast injection we will be checking about flow patency of the vessels which we are going to evaluate in the examination. The 4 to 5 ml of saline will be flushed into the arteries to the patient for the flow patency. Contrast injection will be non-ionic iodinated contrast media, 82, which is generally injecting 80 to 120 ml. According to the patient weight, we will be injecting 1 to 1.5 ml per kg. So if the patient is 50 to 55 kg, we will be giving around 82 point something, the value will be coming. And the ROI we will be placing at the descending aorta, which you can see the yellow circle displayed right here. You can, and the bolus tracking it will, when the Hounsfield units are reached nearly 100 to 150, the scan will be automatically started without the conventional radiographer involvement, because of to avoid the missing anatomy of the pathologies. and we will acquire scan phases in the arterial phase and the venous phase we will be acquiring. The arterial phase will be 15 to 25 seconds to see the arterial flow, and the venous phase will be acquiring 60 to 70 seconds to see the venous phase and delayed arterial phase for the pathologies. And we will be using thin slice thickness 0.5 to 1 mm for the better resolution and the pathological conditions. This is the interface I have taken from the Siemens. When we are planning for the protocol, the interface will be looking like this, entering the kV, MAS and the parameters. These are the general parameters which we are generally followed, but the parameters will be changing according to the patient and their personality, radiographers need and the institution's requirements. And these are the post-processing techniques we are taking in 3 phases. First of all, multiplanar reconstruction we will be taking for the better visualization of arteries, veins and lymphatics in the all directions. And these are some pathologies we can see: critical limb ischemia and peripheral artery disease. And advantages over this is faster imaging, comfortable to the patient and the good 3D visualization, and it is useful in acute limb ischemia disorder. Radiation exposure, risk of contrast injection. These are the radiation protection. We will be following ALARA principle, optimization dose and patient safety and staff safety. The AI in radiology will be the deep learning modalities, automatic reconstruction, patient flow, and the reconstruction, slice thickness and automatic parameters. Conclusion: CT angiography is a effective modality. We will be obtaining in the emergency situations in such as acute limb ischemia, critical limb ischemia. And these are my references which I have taken information about, and thank you so much.